Hi guys, so today I'm gonna want you to show you a couple seating exercise. This one we start with this upper body, and also I work at the whole spine and work on the lower body. Some people cannot sit down, lay down and face down or face up. So this is the best kind of treatment I learned from upper body. So upper body, we want to mobilize that thoracic area. We do not want to put too much mobility on that lumbar area, especially for the older people. And this is the first one. Usually ask my client, place that hands behind the head. If they can't do it, I'll show it to you. So in each side you work. If this is the bigger person, all you do, you place that elbow on your shoulder. So your client's kind of scoop up and you push it right in here, you see? And this is what you do. You just step back and you mobilize that thoracic area. You can work on that lamina. You put this on the lamina. Let me get that camera behind you so they can see what I'm doing here. Perfect. So, like I said, the client is not sitting on the edge, because on the edge he's going to slide off and it's going to, yes, also scare him. But what I prefer, because I'm a bigger guy, I use only my one arm. So I come in up here, you see my knee is on the bed, and I'll show you like so. And I'm coming up here, and this is what I do. I start mobilize that vertebra. Yeah. So you see I'm down. And if you are, come back. Let me show you on the left side and get this camera even more deeper in the back than ever was before. And I show you on the left side. Same thing. You come in up here. Now my left knee, I'm supporting myself. Get you in the back. You see arm is up here, and it's very easy. You see the person is leaning, and I'm working on that. Single. You can do single one. Also great for this kyphos, the upper cross syndrome. Here we go. Something just click.
Yeah, it's a tight area.
Yeah, you lock it in. But like I said, if this is a bigger person, and if you're a woman, you put the pillow up here or maybe some sheets, and you just hung behind you, and you come up here. You come up and you're doing this. If the portable, just make sure you get that right level. So the person is not going to slide off, or you're not going to be doing this. You're going to try to sit down. So make sure you're standing. You're not grinding around your back, so you don't want to injure yourself. If the person, yes, if the person, great. If person can't do this for some reason, he place on the side. Go ahead, place on the side. Same thing on the side. You see, and he's leaning, or he can place this on his forehead like this. Get a little bit inside, so kind of cross this more deeper. You see, here we go. And here, what you can do. You see, you can glide your arm up here in that hole, and here we go. Look at that. You see, you can do that, and you control the motion. So you can rotate him, work on that lamina, and watch. Rotate him. You can do side bending, and you can work on that vertebra by vertebra, and you would feel, again, side bending. Yeah. And step. You see, you step back. You're probably going to see everything on this camera. So remember, this way, you go under, cover that neck, hands right here. You also can lean him up back, or the person plays on your shoulder. This is another way. What else we can do here in sitting position? You can mobilize that shoulder. Usually come up here. Person place that hands on like this, crossing. So what I'm doing here, you see, I'm kind of get that support. So he's on my belly. Like I said, if this is a woman, put some pillow. And when you come up here, you start doing this. You see that hands is up here, so you're probably going to see on that camera. And when you get here, first restriction, you wait. You can get your hands. Let's try the other way. So let's do behind your head. Same thing, you see, he's lean forward, and you can rotate. There we go. And let me show you from the other side. Yep, cross this arms like this. Again.
That's good. That's good.
Yeah, I come in, I grab it, I pull him down, and rotate it. Some people do cross arm. I don't know.
Mm-hmm.
This is like I said, you control him. But the idea is come, lock it in, and do this motion.
Mm-hmm.
And glide is up, down. You see, you can. This is what I like this one because I can do both. I can do rotation and extension of the spine. So leaning forward. Next one, it's important. We're going to work on the whole spine, the whole kinetic, posterior kinetic line from occipital area all the way down to the lower back. So the idea is you have to touch his toes on that floor. Don't do it. Sit back. I'll do the work. It's fine. He's helping me out. So this is electric table. If you don't, we have a benches, all that small benches. Make sure when it's sittable, it's not movable. It's no any rollers because people use that the massage chair and it's gonna slide off, and usually the massage therapist can falling down and injure themselves. So this is electric table. This is good for me. I lower down till you see the knee is start coming up. You standing or no?
No, my feet,
On the floor?
My foot is on,
There we go.
my whole foot is on the floor.
On the floor. So this is, he's feel comfortable. So what I'm doing here, I'm usually show people what we're going to do. So I'm sit down close to him or I explain it to him. So what I want you to do, and this is our, so you spread your legs like this, and all you do is start, when I ask you to start tuck your chin and roll yourself down, you're going to start doing this. Vertebra by vertebra, very slow, don't rush yourself. You start tucking your chin first. It's hard talk, but the mouth have to be close. You tuck, and when you're ready, you see my arms on the knee, and you start gliding yourself down, 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 gliding down your foot and towards that inside. Stay here. I'm going to do my job when I'm going to tell you. I'm going to start helping you out. You start roll yourself back, and you see my lower back is coming first. My chest is still collapsing here, and when I'm going to help him out to raise this chest, the neck is going to be go the last one. The chest is up, and after you're going to look and turn your neck up. I actually feel I need it because when I pull, that left side is not pulling really good. And we're going to do this a few times. After a few times, we're going to do that. We're going to start do those rotations, spine rotation to the left and the right. Someone just tried to call me, but that's fine. So let's do that. And usually, like I said, it's no need to be a lot of lotion. I usually use muscle rub because we work on that fascia. We don't. So this is like a 2 drops. Just make my hands a little bit more pleasant because like I said, sometimes, and what do you do here? I'm coming in the back of the client, I'm standing in the back. I always let them know, the woman, like I said before, what I'm going to do. Because if you just come in and start doing that, the clients don't know what you're doing. So always need to teach your client. I can bend my knee, I can get this close to him. So what we're doing now, I use my knuckles and I ask him to start tuck the chin. And I grab that. And here, you see I'm standing up. I don't want to shrug my shoulder. And now he started leaning. Stay there. And going down, stay here. Stay. You can go a little bit up again and try to do it one more time. No, keep. I'm talking to myself. So keep that chin tuck. And now you can go a little bit lower, start gliding your hands down your foot. It's go towards the middle, towards the inside, and you go all the way up to that ilium right there. Here I'm going to show you next one. We don't want to add anything. Now, how he's going to get up and come up here. His head, I support that head. I don't want him to raise this head up. You're going to see on this camera what I'm doing here. I'm gliding that fascia and asking to slowly stack those up. Now watch. Chest up. Open your chest first. I teach him how to get that chest, open that shoulder, pops, and head is coming up first. Okay, this is the one. Next one, if it's too the table is too high and you're gonna shrug your shoulder, you can use your forearm. Do not use the elbow. Elbow is going to be painful. If you drag that elbow down, it's not going to be pleasant for the client. So first, I'm going to start, like I said, get close. Again, knuckles is right here. So I'm working on that occipital cervical area. Yeah, occipital cervical area. Here, you see I'm start shrugging. What I'm doing here, I'm switch to my forearm and I'm dragging that fascia down. And I can go all the way down till I feel, you see he's leaning, and I can switch here now because I'm not going to shrug my shoulder, glide your hands down. Here we go. You always teach him glide. Towards inside the middle, and you finish right in here. Okay, and you can do a couple more times. Now coming back, ooh, people start coughing. And you also look what's going on with that spine. Sometimes that head is coming on the side. Yeah, so now it's working up. Yes, you can work on that. It's very slow, very slow, very slow. And you can do up here, and chest up, and now head. And what I see when he's leaned to that down, let's do one more time on this camera. Do one more time, glide your hands down. Slowly again, here. And very slow down. Slow, stay there, so I can glide it down. You see, he get that head kind of tilted. So I want to correct that. I want to correct that, and then I can work on that area. See if any pain. And drag it down. Wow, I'm busy today. Busy. And glide down, yes. It's busy when people calling you. They want you. And next one, what I'm doing here, I usually I ask him to stay in this position. I want him to get this arm. Let's say we start with the left one. What he's doing, he's raised this arm up, try to turn, and this one is kind of gliding under your knee. Exactly. Try to get this one. Hold on, I'm going to correct you right in here, and watch. When he's doing that, I try to help him out, and I'm holding. You see, I'm is on the shoulder. I push it down, and one is up, and I ask him to look up and look. Try to look, turn. Good. Now go back. Try to turn back, and I'm resisted. Now keep it arm. So he's trying to rotate back. I'm resisted. 1, 2, 3, 4, 5, and relax. Or you can use the band. Remember the band? Put it around. I don't recommend to do this on the skin because it's not going to be pleasant for the skin. So let's show you on that right side, maybe so you can see it. Go ahead and try to reach. And of course, we want to do both sides because we want to see the difference. Try to look up. Always ask him to look up and try to turn. And this one is more restricted, right? You feel that? Yeah, they're both bad. And you get this to the first restriction barrier. You hold it. You see I'm kind of lean. I'm not supposed to do that. And ask him to turn back. Resist it. And relax. And I'm doing more. Now, neutral position. Remember, tuck chin and ask him to get up slowly. The head is coming first, last. The first is lower back. Now chest up, I'm right in here. If this is woman, I usually tell them to come with a sport bra. And this is the sitting exercise. So all those twisting, it feels good, of course, because we work on that posterior fascia. Remember, the posterior kinetic line. That rounded back. So we try to do that. And this is great. So you're just gliding this down. Okay? So thanks for watching, and we'll see you next week. I have to answer this.